Visit IPPH.org for more information.
Welcome back to State of Play. We're talking about COVID, and we're very fortunate indeed to have with us Dr. Cozzette Lyons-Jones. She is the Chief of Adult Medicine at the Watts Healthcare Corporation in LA. She's also President-elect of the Association of Black Women Physicians. Honored to have you with us, Dr. Lyons-Jones.
Honored to be here. Thank you.
We're going to cut to the chase. You've been a consistent and forceful voice around the notion of healthcare disparities in the brown and black communities. Are these disparities, are these the reasons that there are more deaths and negative outcomes in communities of color, or are there other reasons?
I believe that the pandemic has just kind of exploded what we already knew. It wasn't new as far as the deficiencies in the social determinants of health. We, as a community, were made more vulnerable, not because of being Black, but because of being Black in America. Within the context of living here, we're behind the 8 ball in terms of having a context of health that is poorer because of not having a job, or having a job that puts us at high risk, that we're not able to shelter in place, or to stay at home and work remotely like some other professions. The spaces that we live in are sometimes multi-generational in context. So that is also something that, we have to contend with. When I look at my patients, I service predominantly Black and brown people of color, such as the Latinx population, as well as African Americans. And our Latinx populations in particular can roll 5 to 10 deep in a household, and how do you isolate and quarantine when there's 10 people and 1 bathroom, and 2 bedrooms in the household? If there's poor access to food, if it's a food desert, if there's not enough green space for people to go out and exercise or to safely go outside, all of these things are contributing factors to what we see as drivers for cardiovascular disease, for diabetes, all these other conditions. And that's before the pandemic. So COVID just blew the roof off of that to show what was obviously there, that there's something wrong within the system itself, and that these areas, we talk about equality. I grew up, and we talked about we wanted equal, everything wanted equal. We want equal access, equal access. The language now is equitable, because my needs may be greater than some other person's needs. I don't need equal amount of resources. I need the resources that will get me to better health, period. And it may require more than someone else gets allocated in terms of resources. And that's how I like to see the government play out in terms of addressing this pandemic, particularly in my community.
And I think that the Biden team has put some emphasis on this. Do you know whether they're reaching out to healthcare professionals such as yourself who are serving our community?
No one has reached out to me personally. However, I do know that they've been reaching out and trying to expand the presence of the community health centers in fighting the pandemic. They are looking to ramp up access to vaccinations, access to testing, mobile units, deploying those on the ground and partnering in communities so that we can see more people that look like us administering the care, giving the information so that it's more trusted, by the recipients, because messaging and the package that it comes in is very important within our community in particular, because of the historic infractions against African Americans in particular, and various other groups of color. So you have to kind of keep that in mind, that it's not just an imaginary thing, or, and conspiracy theorists that are running amok. There's true, tangible things that have happened in America in particular that you can point to as the reasons why people have pause when accepting treatments and vaccines in particular, things that you're injecting in someone's body.
What about the COVID protocols? Do you feel that people of color are beginning to embrace those protocols, like wearing a mask and washing your hands?
I think we're getting better. I know among the population that I serve, my patients in particular, they are not even coming to the clinic. I have to beg them to come to the clinic sometimes to get the blood work that we need to know where they are. It's important for us to empower patients to be able to monitor their own health when they're at home and to know the signs and symptoms that put them at higher risk so that they'll reach out and call their primary care physician or go to the nearest emergency room, depending on what the situation is. So we do that by ordering equipment like pulse oximeters to be able to check the oxygen levels of patients at home, blood pressure cuffs, telling patients to get a thermometer. These are all things that help the patient to put their own care in their hands and to know when to access care if they're in trouble, at home, rather than just sitting at home until it's too late to get the care that they need. So these are the things that are important to me as far as empowering my patients.
Well, thank you so very much, Dr. Lyons-Jones. We're going to be right back and get some more of her insights. Welcome back to State of Play. We have Dr. Cozzette Lyons-Jones. She's helping us understand the issue of COVID. Our colleagues have a couple of questions for her.
Dr. Lyons-Jones, we know how devastating this first wave of COVID has been to communities of color. Have we any idea what this new variant may portend?
The new strains are concerning from the perspective of treatment of those people who are diagnosed. The South African strain in particular, we know has weakened the efficiency of the vaccine. It doesn't mean that it has made the effectiveness of the vaccine zero, but we do need to keep in mind, that there is some benefit from the vaccine, even in the face of these mutated strains. Treatment is more concerning, for those people who actually contract the South African strain in particular. When you look at the UK, transmissibility is increased, as a result of that UK variant that's out there that led to Prime Minister Boris Johnson shutting down the UK. All of this is to say that the virus is doing what we expected it to do, which is to mutate. We do have the technology and the capability to pivot and to change the sequencing in the vaccine itself so that we can have newer generation vaccines to administer to the population as needed. The FDA is going to have to work on how to get that to the people's arms quickly, though. And I think they have the blueprint in how we're doing the flu vaccines currently. Each season, we get a new vaccine based on the previous season strain of the flu. So, we have a blueprint as to how we can do that without having to go through EUA, processes over and over again. So that would be my short answer to a pretty complex question, but people should not become over anxious about the variants because we do have the technology to be able to combat it. The concern would be more so about the drugs to treat those people who actually contract the disease.
Dr. Lyons-Jones, thank you. Let me just ask, what's the one thing the Biden administration could be doing that would make your job easier?
Be consistent with the messaging that is consistent, that is not mixed, and that does not have a punitive tone to it against the victims of the pandemic. Continue to have diversity of voices at the table. The task force is very diverse. You have Becerra out of California, that's in Health and Human Services. Marcella Nunez-Smith. You have a familiar face in terms of Dr. Murthy. So it's great that he has diversity of voices at the table, not just diversity in terms of color, but also diversity in terms of context, experience, and expertise, and that these are all people of science and have solid experiences in the industry to be able to bring to the table in making wise decisions for the nation. The Biden administration is actually doing a great job out the gate of showing the priorities and also showing that all voices matter. So inclusion matters and having diversity of voices at the table is important. And so it's not so much a specific sentence or message as to action is what because I'm tired of rallying cries and, slogans and, words. Words mean nothing without the action behind them to bolster it and to push it forward.
So thank you so much, Dr. Cozzette Lyons-Jones. You've been terrific, and we really thank you for your service and your insights. So stay with us here on State of Play. We're going to continue on this important topic of COVID. Welcome back to State of Play. We certainly learned a lot from Dr. Cozzette Lyons-Jones. She gave us an earful and great insights, and maybe she's clearly right about, as we face this challenge, it may be an opportunity to address some of the health disparities within the Black and brown communities. That was my takeaway.
Well, I completely agree, Mayor. She just pulled the covers off of what has been going on for decades. The disparity in health access, the disparity in healthcare generally to Black and brown communities. There's a reason why the death rate is what it is. When Black and brown communities do not have access to healthcare, do not have access to treatment, they enter this crisis already suffering and putting themselves at risk because of the jobs. They can't work at home. And so it's being hit twice.
It definitely being hit twice. But I think what she also causes us, what Dr. Cozzette Lyons-Jones also makes us do, is think about this in macro and not micro. So the vaccine may ultimately save us from COVID. But what about the next pandemic, if there is a next one? And I think we have to be prepared for the fact that this is what happens and may continue to happen as time goes on. If we don't correct the systemic disparities in healthcare and public healthcare, to be honest with you, we've not heard the term, even from those who were advocates of universal health care that much during the pandemic. But what good is it talking about universal health care if there's access on paper, but not real access to communities that need it from qualified hospitals and physicians? So this ought to cause us to, and ought to inspire us to overhaul our entire healthcare system to help those most in need.
No, higher rates of problems with blood pressure, higher rates of diabetes. So, you have so many deficits walking into the situation, as both of you have commented upon. The question is, what kind of incentives, because it's going to take the federal government, I believe, to provide the incentives to make certain we deploy more healthcare professionals into communities of color.